School deworming exercise is a very important exercise as part of the National School Health Program, which we co-run with the Ministry of Education. And of course, the WHO in its 54th World Health Assembly declared eradication of soil-transmitted helminths, being the worms and schistosomiasis of bilharzia, as part of the key agenda, Kenya adopting the school health program in 2008, and working with Evidence Action for the last 9 years, been running this program in these 27 counties. The ministry is providing the drugs that you are seeing being administered to the children free of charge to the children and the parents, and we call the parents and the stakeholders in the education sector and the family generally to work closely with the education sector to ensure that all the children who are between the ages of 2 and 14 who are school going get this. We know COVID is around, and we are doing this exercise in strict observance of the COVID-19 regulations, and that's why we are ensuring that public health officers or Ministry of Health officials in the 14 counties are involved at every step in administration of these commodities. I think previously how the program has been done, we would even give to the teachers who are focal persons in the administration, in the school health program, to administer the tablets to the children. But you can see we are ensuring the children are washing their hands and are taking the COVID-19 protocols as it is, to ensure that the safety of the children is guaranteed.
And one of them was the deworming, among other programs that we have together with the Ministry of Health to ensure the healthy growth of our learners in all our public primary schools and even in private schools. So in March, we warmed over 2.6 learners. Currently in 14 counties, we are targeting over 4,000 learners, a total of 6,000 plus learners that we shall have dewormed in the period. The main reason is because we realize a child who is not dewormed, a child who is suffering infection of worms and other infectious diseases can never concentrate in class. The level of absenteeism is also very, very high. But with the deworming, tumeona kama watoto wanaingia mashule, tumeona kama absenteeism imekuwa reduced by 25%. Tumeona watoto kama wako very healthy, hata mlikuwa kwa hapa mkaona wakichukua madawa zao. The kids are very healthy and very, very jovial.
Bashir Isak. I head the Department of Family Health, and school health is one of the programs. The others are nutrition, child health, newborn health, maternal and reproductive health, and adolescent health. All those come under Department of Family Health. This is a program where we are partnering and collaborating 100% with the Ministry of Education. And it's called School-Based Deworming Program. We do it twice in a year. And this is based on the burden, assessment of the burden that we have carried out. For your information, the global evidence for this deworming school program has been done, the research has been done in Kenya. And they found out that there is a huge benefit, economic benefit, developmental benefit, growth benefit, nutritional benefit to the children. And we looked at where is the main entry point. Schools became the main entry point. Ideally, it's 2 to 14 years of age. Children are 2 to 14 years of age. But even those not school-going children, we allow them to come to the school area and take their medicines. So mine is to actually open up the flow, because we've had the general perspective of what the program does, and allow you to maybe ask questions that are not answered or where the gaps are, so that we can fill in the knowledge gap in this agenda. The program plus the technical knowledge. Over to you.
Most of our children, as they come to school, as they go home, you know, on the way they eat so many things, and around that time they don't even have time to wash their hands. So it's most likely that they get worms And most of our parents, maybe they are not much sensitized that the children are supposed to be dewormed. So this exercise in schools is actually catering for many thousands of children who are in schools who may not have had the opportunity to be dewormed. We want to appreciate the resources the government has put together to ensure that children in public schools and also those who are in private schools, they are reached by this very important exercise of deworming them. You know, worms can keep children out of school, and if they are not monitored well, it can even lead them to be sick. And we wonder what is happening. Our children don't look healthy, don't look active in class, simply because of worms. Worms can have far much effect on the health of children.
Let's clap for ourselves.
Hands, clap, double, single.
We need to prepare the evidence actually we are part of it. Na wizara ya afya na wizara ya elimu
Push it with some water, then we go back to class.
Chill.
Madam Director, please.
cool down your mask, Joy. Come, Tina, this side, you want to make sure you follow, okay?